Good afternoon, everyone. I'm sure you're enjoying the conference, and again, I'm sorry to not be there in person, but I'm happy to do this online. And I'm going to talk about setting up the LGBTQ friendly clinic, and we'll start from the basics here as to why do we need to do this. It's primarily because we said and we took this oath: first, do no harm. It is our responsibility to our patients to give them the best that we can offer to anyone and everyone who comes to us. It is not for us to discriminate or judge any patient who comes to us. I spoke to you about the compassion in the first lecture, that our compassion, while it is dependent on many factors, we have to identify it and then we have to transcend it so that we make sure that we offer the best care to our patients, those who are under our care, and we do no harm. Now, when we talk about from the endocrine point of view specifically, what are the issues that the LGBTQ community members will come to you with? So, from that point of view, you will see transgender individuals coming to you for their specific hormonal therapy related help. But remember that these patients are individuals who will have other issues also. So a large number of them will have diabetes, large number of them may have other endocrine problems. Right? Diabetes is so common. So while an individual who's undergoing who's sort of in the process of changing their gender or is going through the journey of that, it may become obvious to you, okay, this person has come to you for with the certificate and they want to start on hormone therapy. But you will on everyday basis see a large number of patients in your clinic who are from the LGBTQ community, who would come to you for management of other illnesses such as diabetes or other endocrine related illnesses, and you will not even know that they are from LGBT community because they are not going to come and tell you. And the importance of setting up the clinic in an LGBTQ friendly manner is to ensure that all of these people feel comfortable in your clinic. Remember, while we are doing this for the greater good of the society as a responsibility to the community and as a part of the oath we took, also we have to remember, if we treat these individuals with respect and dignity that they deserve, they are going to keep they're going to keep coming to you for their treatment. Also, they're going to refer you a lot of patients. So your practice will grow if you are able to get these things right. Now, the role of a healthcare professional in this is primarily to make sure that we reduce the ignorance, we reduce the prejudice. Now, ignorance is something where, I told you about the homophobic attack I got, where the person believed that gay people are bad and I don't want my children to go close to them and they are abnormal and they need to be treated. That is ignorance. So if you see somebody who, whether you're a colleague or friend or you're a student, you have to educate them and make sure that they are not ignorant anymore. Then also prejudices. Some people may understand about LGBTQ community, but still may be prejudiced because of whatever reason, religious reasons, their upbringing or their belief system, and they may then land up discriminating these people. So for example, if a transgender individual comes to your clinic and your secretary or your front office staff is not very happy to see them, they may tell them that, oh, doctor's appointments are full, you cannot see them. Or they may say, ha ha, baad mein aa jao, last mein aa jao. So that is discrimination, and it may then lead to insensitivity and damage to these individuals, in terms of you may make them feel again so discriminated that they may run away from the healthcare system and then land up going to a quack, or not taking the treatment at all and damaging their health significantly. So we need to create a safe zone in our clinic, and that safe zone should include sexual orientation, which means anybody with any sexual orientation is welcome here, whether you are gay, bisexual, asexual, doesn't matter, or heterosexual. Anybody with whatever gender identity, whether you identify yourself as transgender, whether you identify as cisgender or genderqueer, doesn't matter. And also people with gender expression. So for example, if it is a trans individual, and they are expressing their their gender expression. So for example, a man who is dressed up as a woman because they feel that they are a woman, they identify with being a woman, then that is their gender expression. So we need to create a safe zone for all these three parameters in our clinic. But what are the barriers to creating this? So main problem is limited access. People from LGBT community find it really difficult to find good doctors who are supportive of them, who understand them, who accept them for who they are. That is the biggest barrier. As a part of Health Professional for Queer Indians, a few years ago, I tried doing a survey, and I started, I had compiled some lists of doctors who are supposedly LGBTQ friendly, and I started calling them up and having discussions with them. And I was horrified to see, I mean, the last straw when I stopped that project was an elderly gentleman, a psychiatrist from, I think, Coimbatore or somewhere, where he was very sweet, he was very nice and very supportive of LGBT community. And he said, "Beta, I'm very supportive of them. I make sure that all of them get married and some of them even have kids." And I was so shocked with that. And that man he truly believed that the best way to help a gay man is to get him married to a woman and have a child. He truly believed that, and he was doing that as a project. And I was like, oh my God, this is just too much. I can't, handle this. This is absolutely crazy. So and that is something we have to address in India. This is a big problem. Many individuals have negative experience. I had a colleague of mine who was an oncologist and a trans man, and when he came out, he went to his when he was doing his post graduation, he went to his medical college psychiatry department, and that psychiatry department head told him that this is all rubbish, this is all in your head, this is what happens when you see Netflix, and there is nothing like that, and you have to get on with your life and get married. Now, this is a psychiatry head telling an oncologist. That is the level of problem that we have. And all these negative experiences create issues. I have a friend of mine who had severe stammering. And then he kept seeing counselor after counselor after counselor, psychiatrist after psychiatrist, no help. Finally, till such time that he met somebody who was LGBT friendly, and he actually came out to that individual as a gay man, and it was like magic. This friend of mine is a CFO of a very large firm now, and you would not believe that he ever stammered. So these are the issues that the LGBT community faces. And of course, the major issue is that you may have a doctor who's very supportive, who's very nice, who wants to work for the LGBT community, but doesn't know what to do. So that is something that we are addressing through the conference like today, where we are working on getting everybody on board and training everybody to support the LGBTQ community. Now, here are some of the tips that we can do. Now, when you talk about creating a LGBTQ friendly clinic, you have to understand that you not only have to train your doctors, but everybody who works there. If it is a hospital, then everybody who works there, which starts right from the person who answers the phone. So your telephone operator, to your secretary, to your peon, to your ayabai, to your ward boy, to your security guard, for example. Suppose a Hijra individual is walking into your clinic, and if your security guard says, "Arey chal Hijra log idhar nahi aane ka," then that's the end of all the work that you're putting into creating a supportive clinic. So even your security guard needs to be trained, and of course your doctors, your nurses, your students, all of that. And you can start by creating some posters which depict that your clinic is LGBTQ friendly. Your registration form should not have just Mr. and Miss. It should, gender wise, it should not just have male and female. It should have at least, other written there so that the person can write there. When you examine the patient, you have to be more careful, you have to be more supportive, and ask the individual, would they, what type of chaperone would they like a male chaperone, female chaperone, of their choice. When we ask for investigations, we again have to be careful about asking the investigations which are only very relevant. One of the common investigation that is done in terms of gay men is their testosterone level. Now we know testosterone level has nothing to do with sexual orientation, but people still do it. Why? It doesn't make any sense. So make sure that you do only what is in the best interest of the person. The toilets also need to be gender neutral. Now, this toilet issue comes up quite often, and why this is important is that if you have a transgender individual who has come to your clinic, where do they go to the loo? If they go to female loo, women may complain, male loo, male may complain, and they may feel completely outcasted and they may never come to your clinic again. This is an important issue. So creating a gender neutral toilet, you can just have a toilet which has no sign on it, just say toilet. It doesn't matter male, female, how does it matter? In a large institution, if you are a teaching institution especially, and if you have the luxury of space, then ideally you should have um, special wards for transgender individual, and this is specific to transgender individual. You need to train your staff for issues related to sexual harassment, again more so for transgender individuals, because there are horrific cases of transgender individuals being admitted into the ward and then harassed by patients, other patients, patients' relatives, or even staff of the hospital. Education of caregivers, I told you already, but especially from the communication skills point of view, and also important thing about the pronouns. So when you have a transgender individual walk into your clinic, you need to ask them two questions. What would their pronoun be, whether it would be he, she, or they, or any else, and what name would they like to use? That is again an important thing, because they may have moved on to another name, and they may want you to call them by that particular name. While you're doing the endocrine part of it in your clinic, you must have a multidisciplinary referral system, and I'll talk about what are the components of that referral system going forward, which are queer friendly. So just having an island of queer friendly endocrine clinic and then not have any other support again will not work. So we need to have a good queer friendly referral system, and of course all these systems need to be non-judgmental. Bharati Vidyapit in Pune, and specifically I would name Dr. Jyoti Shetty, she's a psychiatrist, has been instrumental in developing a role model for LGBTQ friendly queer clinic, psychiatric clinic. And how they did it is they first of all tied up with an organization, with an NGO, and developed a training program for the UG and PG teams. They developed a core team, identified the services, built a strong referral system. Then they advertised it to within the LGBT community so that people from the community can make use of this system. And then they kept changing their processes, they kept reviewing the process, they kept improving it, and they started scaling up as well. And now they're also helping other hospitals to set up LGBTQ friendly clinics. Important aspect of that is they hold focus group discussions with the LGBTQ community, asking them what would they like. Now the team in LGBTQ friendly clinic is large, and this is just some of them. Most important part of it, of course, along with endocrinologist, is psychiatrist and psychologist. This is absolutely important. And of course, from the transgender point of view, you have plastic surgeons, you have other surgical colleagues, and also in intersex individuals, pediatric surgeons get involved. Then you have dermatology, pulmonary medicine, ENT specialist, integrated counseling and testing center, speech therapy for transgender individuals. These are important aspects of a queer friendly system. There are a lot of changes that are happening in the legal system in India, and most important, I want to highlight is the Madras High Court judgment in 2021, where conversion therapy of individuals, where this horrific practice of trying to convert homosexuals to heterosexual, which of course doesn't work, um, has been banned and it is illegal, and anybody who is practicing that can be taken to court of law for further action. But there is a lot more that needs to be done in terms of harassment, discrimination of these individuals, transgender individuals especially. We need to help them to get jobs, because these people get into sort of a circle, because when they are young, they start having maybe crisis around their gender identity, gender expression, which may affect their educational performance, which may then get them thrown out of the house. So there is lack of education, there is lack of support, but there's a lot of work now being done on getting them into mainstream job professions and training them into certain profession, and especially these individuals are excellent individuals to work in the healthcare industry. Gay marriage is still a dream. There is a court case going on that. Adoption is still illegal. Surrogacy is again not possible. And from trans individuals' point of view, we need to work on trafficking and begging as well. So there is a lot that needs to be done. And as a member of LGBTQ community and a representative of the community, I will keep coming back to societies such as Endocrine Society of India, Indian Psychiatric Society, who has been hugely, hugely supportive of us, and ask for help. I want to end with the photo of these two books, which I urge all of you to buy and read, please. Working Together is a recent book which Bindu Madhav has published, which is absolutely a guide on how to build your practice, how to be yourself LGBTQ friendly. And Basics of Sex, Gender, and Sexuality is primarily for parents, counselors, and allies to understand what the LGBTQ community is. Bindu Madhav Khire is an exceptional individual. He runs an NGO in Pune and has been doing a great amount of work for the LGBTQ community. And Bindu basically has published these books. You can write to Bindu, and I can possibly tell you his email address, but I should have checked this. But I will email all of you the names of these books and Bindu's contact details as well. So thank you very much for attending the conference. If you have any questions, please get in touch with me. I'm always happy to connect. My phone number and email address, again, I will share with you in the email. I hope you are enjoying the conference. And again, thank you very much for coming. Thank you.